Professor Patel is doing amazing things in the world of pharmaceutical, of the whole idea of training pharmacists, of actually bringing this specialty to the forefront. And he's done all sorts of things, including now working in Oxford as well, Oxford University also, where I'm sure he's going to tell you that through his own idea of the art of the possible. I mean, Professor Patel embodies what it means to actually leave this phrase as to what is possible. He's full of energy. He's full of excitement. He's innovative. Obviously, he's been decorated with the Queen's Award. I think it was a Queen's Award at the time. Now it's a King's Award. He's been recognized locally, internationally, everywhere. So for the pharmacist in the house and for all of us, I'm going to introduce the eminent Professor Mahendra Patel, who's also now my friend, and I met you this year. I won't tell them how we met, but it's been amazing just knowing you. So I'm going to give you the floor because I would like you to have as much time. I know we said 20 minutes, but I've said let's do 25 so that everybody can hear you speak and just take, and also if you have questions for Professor Patel, please write it down and you'll be able to, you can post that in the chat box, and also during the panel session, you'll have a chance to also ask questions as well. Okay, if that's okay with you, I'm going to hand over to Prof and allow you to speak. If you need any help, yeah, okay, you've got that done already. Okay.
There we go.
There we go. So just need a slideshow now, don't we?
That's fine.
Perfect. Thank you very much.
So thank you very much for that kind introduction. I think what I normally do is, possibly this is my personality as well, really. I'm proud, I just love sharing and inspiring, and well, not inspiring, but hoping that what I do can inspire people around me. Sometimes it does, sometimes it doesn't, but I would like to think it does more so. And also being in an academic career, my whole life is around how can we support others? How can we get them into positions of leadership and recognition, but also enjoy their journey at the same time? So, and this sort of typifies my own life really in many ways, which is I go like a house on fire, and that's what I'm going to do here as well. So thank you for the opportunity. And what I thought was, because there was so much, and I've only got 20-25 minutes, I was thinking of breaking this down into two halves, but let's see how we go, and let's see if I can give you the second half in this very quick introduction. So it's extending, beyond my pharmacy profession, being a pharmacist and representing the pharmacy profession, through interest in health and health inequality. And I largely started this with cardiovascular disease, diabetes, and also my work around medicines adherence, how we know, and my association with NICE, and how all these these interests just emerged. It wasn't because I had any family illness or etc. They just emerged through my leadership. And how, as tomorrow's leaders, I want you to ponder about what you see as your dream, what is fantasy and what is reality. Started off my career with the University of Bradford. I did my training in this pharmacy at Boots in the centre of Bradford there. I then started off my, very straight after my training, the Lily Jane's bit is where I had my community pharmacy. That was straight after training. My first day as a pharmacy manager on the register was working in what is now closed down, but now owned by Lily Jane's, that little, where the shutter is, where I had a community pharmacy. I worked there for a year, and then I went off to America. I was offered a job in Montgomery, Alabama, which was a real mind-blowing experience, and stayed there for a year, and then came back, and I was working for SuperX Drugs there as a pharmacy manager, but then came back to community pharmacy because I thought I still felt a little bit homesick, even though I loved Alabama and the deep south there as well. So came back to Leeds, had my community pharmacy in a little place in Oulton in Leeds, which was middle to sort of middle class, lower to middle class, predominantly white. And then I had another pharmacy there very quickly in Rothwell, the adjacent neighborhood. And then I went off to Bradford there, which is very highly deprived in the areas that I was working in. And it was and it was one of the most deprived wards in in the UK, really. So this is where I started off, came back, had a pharmacy in Oulton, then into Rothwell in the Leeds area, predominant, all white, lower to middle class, and then into Bradford, where I also had that pharmacy there as well. There you are. And this is where through that, it was one of the lecturers that said, why don't you know, I've seen the inequality between the two areas, one largely white, one largely ethnic minority deprived. And I saw that some of the issues around health inequalities, which led to my first publication, the BMJ, prescribed lipid lowering drugs, which I found was that people where the prevalence of heart disease was twice more in South Asian community in 1996, that the chances of receiving preventive medicines like statins was 50% less likely. So not only did they have a higher chance of dying from heart attacks, they're receiving treatment to prevent those heart attacks was 50% less as well. And that was published in the BMJ. And that was over and above deprivation index. So ethnicity was driving that picture there. This is the Jubilee line of health inequalities that you may see. You know, it's just a few miles apart, but for every 8 stops, you could see that the light, for every stop that you take, the life expectancy as you travel from west to east was decreasing. And that's how I see the map, really, in many ways. I also did a lot of charity work. And through that, I brought communities together. And this was in the Yorkshire Post, but it also got into the Times, where how can we keep healthy, keep fit, and brought the British Heart Foundation into that element through five-a-side football. Then I went on to University of Huddersfield, and this is where fantasy or reality came. And I looked at the British Heart Foundation, the statistics. You can see the northern parts of the UK was largely higher prevalence of heart disease, premature heart disease, and dying earlier as well. And through that, I worked with the Champions for Achieving Better Health in Sheffield, CABS acronym, which was the taxi drivers in Sheffield. And I brought them into the community and how they can promote health through their jobs, but into the community. And this in terms of preventing heart disease, but looking after themselves better as well. This became model practice. It was also showcased in the Marmot Review of 2010 of engaging with communities, and it was also HSJ Awards finalist as well. I then developed resources for the British Heart Foundation, as you can see there, and I was continually showcasing on the website, but also through pharmacy professionals. How can we look after ourselves better? This was some of the regular articles that we used to write, and that I used to write for, and supporting people from high risk of heart disease, those living in areas of high deprivation, and from ethnic minority origin. I also was continuing to raise money for the British Heart Foundation through this work, and I was selected to be invited for the reception dinner with the British Heart Foundation in the days of Prime Minister Cameron, and that was from his wife there. Then I went on to look at NICE and the National Institute for Health and Care Excellence. We could see that people not taking their medicines, 33% of the people were not taking medicines for their heart problems. A huge burden. You may not remember this guy, but he was one of the most iconic comedians of the time, Tommy Cooper, and I then supported his campaign into Tommy Cooper died on stage of a heart attack, and it was getting that message across, really, and the importance of taking your medicines. I then went on to work with NICE, and then produced. I was a spokesperson also on the advisory, the advisory group for the panel for the medicines adherence guideline development group. I was a member of that development group. How can we support people take their medicines more effectively and better? I then went on to promote their NHS evidence guideline resource, which is, we often use Google and various other platforms to source information, but they're not always, they're not, they're advertised, sponsored, but what we want to do is an evidence-based platform. Healthcare professionals shouldn't be Googling, and therefore this was the first time NHS Evidence brought its NHS Evidence website, evidence-based practice, what works best, and I was promoting that. Through that, I led a National Student Champions program where through the medical, dental, nursing, pharmacy professions and faculties of universities across England, Wales, and Scotland, I brought them into a training program where students became ambassadors for NHS Evidence. And that was the first of its kind. And this was a program that was a pilot study for NICE, using medicine, dentistry, pharmacy, nursing. That was and then how students went through to their universities and showcased that. These were my champions. We selected 4 champions from each faculty, 40 universities, I've said, in the end. It was a program that I led on, initiated and drove, which became a national program, so that when people graduate, qualify, and in their practice, they're using evidence-based practice, not just any evidence that they can come out to, really. And this was early learning as well. You may not recognize the photograph on the left-hand side, but that is the Professor Sir Mike Rawlins, who's the founder of NICE, sadly passed away now, no longer with us. That is a photograph where we were invited with my student champions from the different disciplines at the national, at their executive board meeting, and that's when it was rubber stamped to be rolled out as a national program across medicine, dentistry, nursing and pharmacy faculties and different universities across there. That was showcased on the NICE website. And that was my fellowship program for NICE in 2013. It started in 2010. And because that was an innovative program that brought everybody in from a very early stage, I was one of the first of the 10 to be awarded a fellowship from NICE at that time, really, and the first pharmacist. I also then, working through the NICE quarters, went on to become vice chair of its accreditation committee for the NICE accreditation of evidence-based guidance and practice, and where I was served there for a number of years. I also became a judging panel member for its Shared Learning Awards, and also advisory member on its quality and productivity program. I then was one of the early members and the founding members, co-founding members for the Mouth Cancer Foundation, which is a national charity, online charity for early detection of mouth cancer. And again, these are non-paid jobs, but to showcase how people can be better supported in the prevention of mouth cancer. And this was a campaign with the largest pharmacy network group in the community pharmacy in the UK. Lloyd's Pharmacy then shared that with over 1,500 of their pharmacies in terms of the importance of early detection of mouth cancer. And it was the Bite Back at Mouth Cancer initiative that I supported at that time, with all its things, and even managed to get the Royal Pharmaceutical Society to share on that as well. This is my work with the South Asian Health Foundation. You know, we often see, and my work is around health inequalities, really, and how we look at the fact that prevalence of disease, particularly as I've mentioned with heart attacks and diabetes, hiring people from Black and ethnic minority origin, is how can we support that? Death rate tripled in 20 to 30 age group for South Asians. Heart attacks 5 times more in that community than any other else. And this is how I was supporting diabetes, how we were going to reach crisis levels if we didn't look after ourselves, particularly with the obesity tsunami around the corner as well, and showcasing that. We went out to communities up and down the country, working with them, and what is type 2 diabetes, how can they be better supported, what do they need to avoid, all about healthy living, etc. We did videos in different languages, DVDs, etc. And we launched these educational resources for the South Asian Health Founders of the House of Lords. And we won the South Asian Health Foundation Team Diabetes Award for the BMJ in 2016, I think, about all the different work that we did in different communities, using different platforms, different methods of reaching out to communities, etc. I was also, through my research work, working as a champion for Yorkshire and Humber research, promoting research engagement, and through that, there was a research-ready resource that I developed in the early part with the Royal Pharmaceutical Society in helping pharmacy professionals become research active so that we can get the evidence base to support people. I also did the same, copied the work that I did with NICE as student champions, as champions for the Royal Pharmaceutical Society, and that was a program that went into every university in England, Wales, and Scotland, barring a few, to create champions to promote the profession through students. And these are my champions regularly coming through and accredited. This led to be also, I was invited to the Queen's 90th birthday party, as well as celebrations and in recognition of the work that I'd been doing. I also received my fellowship from the Royal Pharmaceutical Society with some of the work that I'd been doing, and also through that work managed to get the Royal Pharmaceutical Society accredited for its guidance that it was producing through NICE. My work with the Wilkes University in USA was another bit where it was a novel student exchange program with Wilkes University pharma students and the pharma students here, and this was through Huddersfield University. And this went on for over 7 years, where I managed to get the funding, and students would come over from America, have 4 weeks here, and they would be then signed off and look at practice in different areas, hospital, community, primary care, etc. And our students would go across there as well, would build their CVs. They were getting, often students were saying that thanks to this program, we were able to secure the posts that we wanted. And this was with people will know him really, of Sir Patrick Stewart, and of film fame as well, but also a great ambassador. Went on to the academic unit of primary medical care at Sheffield, where I was honorary senior lecturer there, and I received a principal fellowship at the University of Huddersfield, and even went on to extend that work to the University of Cork, College Cork in Ireland, in terms of the electronic platform for preparation for professional practice. I did my fundraising work. You can see this in my external work that I used to go on at the same time, raising nearly £500,000 for the British Heart Foundation. I also chaired and opened the Wakefield District British Heart Foundation fundraising group, and was voted Volunteer of the Year Award with the British Heart Foundation for the region. That's just me. This is the various parts of work that I did, again with the charity work, also founder and chair of the Yorkshire Indian Society Charity Trust as well. This went on to be recognised for the Charter Award by the Royal Pharmaceutical Society, where I received that a number of years ago. And then this led to the culmination of the Centre for Research Equity at the University of Oxford. So was it a dream? Was it reality? Well, I would like to just ask you, before I came to the Oxford work, how long do you think it took me to get to the Charter Award and all this?
How long?
I started in 2006, and I did it in 10 years. And this is my journey. And it's a kaleidoscope. It's from the Royal Pharmaceutical Society to NICE, to Wilkes University in USA, to University of Huddersfield, to NIHR Research, to the South Asian Health Foundation. If you follow all those journeys across, they were award-winning, and I started on the left from the University of Bradford to that point where I received the Royal Pharmaceutical Charter Award. And I also did a charity campaign as well, continuing, you know, my challenge to you is get your education under your belt, become the person you want to be, go away and make it happen, and don't shout about what you've achieved, because if it's worth it, others will do it for you. Fingers crossed, you can do it within 10 years. Now, I haven't shared, and I'm not sure, but I might be able to share if I may. Have I got 5 minutes? Have I still got 5 minutes? Can somebody?
Yes, you've got 5 minutes exactly.
I may be able to share something. I'm not sure if it will allow me.
While you're trying to figure that out, I'm going to read out a few. I think there's some questions in here which will take. And then once you've got that, then we will pause the questions. I mean, this is just so inspiring. And I mean, I have my own questions, but I'm going to take the question on here first, which was the first one. Tapiwa, who is one of our scholars, is asked, I mean, how do you ensure that you are serving your community authentically and efficiently in whatever work you do? So that's an important question.
Am I able to share this? Is this sharing?
Yes, you can share that and then come back to this question after.
Okay. Is this slide sharing?
We can see quite a few slides. So slideshow. So you need a slide, a slideshow. Yeah, we can see it. Yes.
I'm just going to go through very, very quickly, right? I mean, I just jumble these together because I've only told you my story for the past 10 years up to 2018. But since then, you thought that was something. This is what I received the Queen's Award, the OBE for service to pharmacy in 2022. I started just playing in the rubbles of the University of Oxford. And then in 2023, I received an honorary doctorate from the University of Bradford as well. This is my work in India, where I went on then to champion antibiotic guardians. And I was the first to be awarded a fellowship by the Indian Pharmaceutical Association in 2019 for the work that I was doing in a number of states in India around raising the awareness of antimicrobial resistance. India is one of the biggest contributors towards antibiotic inappropriate use of antibiotics that could be supported better as well, really. This was my work in some of the universities. This is me presenting in China and sharing some of that work. I also did a lot of work with media, with BBC Radio. I used to do that regularly. As you know, you've seen that. This is me in the Lebanese countries where, and the Arabic countries, where in Lebanon I was pronounced. This is in Morocco itself, where I received an honorary membership from the Lebanese Pharmacy Association, really. I became elected member of the Royal Pharmaceutical Society. This was diabetes and fasting toolkit that I helped bring people together and was showcased on the BBC as well, really. First to be awarded a fellowship at NICE. I also went on to Scotland to work with the Scottish Intercollegiate Guideline Network there, doing a similar program for champions. This is my PhD. This is my charity work. This is now where I became professional advisor, Chief Pharmaceutical Officer for NHS England as well. This is me receiving the honorary doctorate. Invitation to the Queen's Garden Party. As you can see there, I got the Lifetime Achievement Award for pharmacy. I can't remember when that was. I think 2021. Charter Award. And this is the real accolade as well, really. The Prix Gallienne Award, which is equivalent to the Nobel Prize for Global Research. which we won this year, and the first of its kind, really. So that is the Prix Gallion Award for supporting innovative research as well. This is working with the Nigerian diaspora, the Medical Association of Nigerian Doctors across Great Britain, and where I was honoured for the work that I've been doing with the Nigerian community. And now we've got a formal collaboration with them as well, really. And this is my work through Oxford, where the work was showcased in during COVID, how we managed to recruit people from diverse communities over and above national census data, which was historically very low in recruitment when it came to people from Black and ethnic minority origin. We depicted that story through art, and the partnership that I've developed now with Northern Ireland was showcased in Stormont at the Parliament buildings there, really. There we are. That's history being made in Northern Ireland through the Partnership Centre for Research Equity, and we have a manifesto there as well, and that was depicted, as I've said, through art. I also became the first pharmacist to become a fellow of the International Institute of Organizational Psychological Medicine earlier in the year as well. This is the work that I've done with the Arab countries, where we signed a manifesto with the Lebanese pharmacy profession to work with us with the Royal Pharmaceutical Society, and signed in front of 1,500 people and the health minister at the time, really. The work has been showcased in the Lancet, where in terms of the COVID-19 work, this is all post-2018, and around the importance about inclusion and diversity. How do we reach out to those communities? That's made me receive my OBE, and my work where I was appointed at the University of Oxford to strengthen their recruitment patterns from people from Black and ethnic minority origin. Also received an award from BAPIO, British Association of Physicians of Indian Origin, in 2019, recognized there as well. I really don't know what this one is about, but oh yes, I'm now on the UK Pharmacy Professional Leadership Advisory Body, supporting how the pharmacy profession, how it can become a Royal College eventually, really, as well. This is working closely for many years with Black Pharmacists, UK Black Pharmacists Association, and receiving an award there as well. And this is me receiving the white coat ceremony at the University, Wilkes University in Pennsylvania. This is the number of antibiotic guardians I've got in India. You know, this was across different states. It was in 2018 when I started, there was 315 antibiotic guardians in India. Within 1 week, it went over 3,500 antibiotic guardians. That is the end of my story. I stopped sharing, and apologies if it's gone over.
No, it's fine. Thank you so much, Professor Patel. I don't know how you find the energy to do all of this. And I suppose my question to you is that what inspires you to do everything you do? That's my question, but you can answer it in conjunction with the question that I asked before from Tapiwa, who's one of our scholars, who says, how do you ensure that you're serving your community authentically and efficiently in whatever work you do?
It's a very interesting question. So just to bring that into perspective, we saw during COVID, which was a big test for everybody and shone a light that's been there for many, many years, that's been dimmed, that how do we reach out to those very communities? How do you build the trust? If you look at the COVID vaccines, people from Black ethnic minority were the least likely to come forward. There was 70% people over 70 were least likely to come forward for their vaccines. How do we change that dial? Yet within the primary care clinical trials, we changed that dial. We got people we managed to work with Black communities and help them to engage, but understand what trials means, what research means, how can it benefit, how are you playing your part? And we, as I've said, we went over and above the census data, which has traditionally been saying, we can't reach people from Black and ethnic minority communities. They're hard to reach, they're difficult to reach. And we didn't have any real dedicated investment to get to these people, yet we did it on scale. This was the largest clinical trials in the world. recruiting 25,500 patients in 4.5 months at a time when everybody was, caring for people, having grieving, losing people, loved ones, jobs not safe, etc., losing jobs, and yet we still managed to recruit people virtually. And how did we do that? It is about understanding the communities. One size doesn't fit all. The messages that we were getting during COVID was as if everybody was going to listen to the TV at 8 o'clock, 9 o'clock in the evening. Everybody think, oh, well, what does it mean for us? And now you want us to, and we have the tradition of the Tuskegee trial and the dark experiences of research in Black communities. How do we get them on board? And the government trust was not there, but it was getting into those people. To give you an example, the Black community that I was working with, the UK Tanzanian Health Alliance, I actually presented to them on Christmas Eve virtually whilst they were having dinner, and they were saying, we want to get involved in research, we want to engage. It is, can we hold hands, can we work together, but building that trust, but it's knowing the communities, the cultures, the experience, and trying to break down those barriers. It's not going to happen overnight. So that's
what inspires you?
Inspires me.
Final question before
I don't know what inspires me is, I keep feeling that as one door shuts, and it's a cliche, another one opens, but none of this connects. I've gone from health inequality into research, into professional leadership. It is about, possibly the only thing that inspires me or the energy that keeps me going is that the people that we have around this webinar today, they want to learn. It is about sharing my experience that I was never able to, I was always an observer in my life. How do you get to, because I come from not a privileged background, seeing that, learning from that was the inspiration that keeps me going. But I know now I'm in a fortunate position, and it's that position that I can see and relate how people may need support, and if they reach out, how I may be able to support them, open doors, open windows, and it is about breaking that glass ceiling, really. So all I'm saying is nothing is impossible. We can continue to do, but don't wake up thinking, always wake up thinking that you can do things. Tomorrow will never come. Make today count.
Okay, so I'm going to ask you put you on the spot a little bit before I get this scholars up. You mentioned about student ambassadors and student champions, and that really got me excited because, as you know, I'm in Lagos at the moment, and I'm very involved with my alma mater, and we have lots of pharmacy students. So that sounds like something that we could actually emulate or even copy. And I know I have a few pharmacy students in here as well. Is that something that will you look towards Nigeria for things like that, and how you can collaborate with our best university in Nigeria, which is University of Lagos, pharmacy department on things like this?
Well, I think the issue is that I don't just think pharmacy. That's the other. I must emphasize that. So when I set up the Centre for Research Equity at the University of Oxford, they made it clear, it's not just pharmacy. We've got to bring it everything. And I think you as a doctor, you don't think you're a doctor, you just do your job. So and you bring others in. So I don't always, it goes without saying that we are practicing within our profession rather than reminding ourselves. The work with Nigeria, just as I've done with India, just as I did with the Lebanese government and the authorities there and the profession, as I've done with the Arab countries as well, is, as you know, with MANSAG, we have a manifesto that's now been created, and that was signed in front of the health minister in the conference last month or the month before, and how we can share that in Nigeria. It'd be a delight to actually use some of these models to work with the Nigerian students, not just in pharmacy, but in medicine, in nursing, in dentistry, and how we can make them champions. One of the things that I feel, and what inspires me is, possibly I'm just a simple person, is having that simple thought. How did you think I got NICE champions? How did you think I got Royal Pharmaceutical Society champions? We all want little awards, but you don't have to give awards in material things and recognition. So I can make you a champion. You would then think, hold on, I'm a champion for my country here. That is the biggest accolade somebody can get. I'm a champion for my university. That helps them to move forward and it empowers them. So I think it doesn't cost anything, but you are actually having that real energy for people to think and have belief and have confidence in themselves to do something that continues to excel and inspire others as well, really. So setting that seed, more than happy to work with that in Nigeria.
Thank you so much. I'm so grateful for your time. It's been amazing. I mean, you're going to come back later for the panel Q&A. There are other questions, but in the interest of time, I think we have to move on to the scholars panel, and then we'll have you later as well, just to have a chat. Thank you so much, Professor Patel. It's been amazing. Thank you. Thank you.
Thank you for having me. Thank you.